In this video, you or your caregiver will learn how to disconnect your infusion pump at home when your infusion is complete. You should have received a pump takedown kit prior to leaving the infusion center where your chemotherapy was hooked up. The kit should contain everything you need to disconnect the pump. Gather the kit and find a clean workspace with a flat surface. If possible, use disinfectant wipes to clean the area. Wash your hands with antibacterial soap and water for 30 seconds. You want to make sure you wash under your fingernails, around your thumbs, your palms, the back of your hands, and in between your fingers. Rinse well and dry your hands with a clean paper towel. Open the takedown kit and place the drape on the clean workspace. In your kit, you will find one mask, one gown, two pairs of gloves, two pre-filled sodium chloride syringes, one pre-filled heparin syringe, an alcohol wipe, a transparent dressing, and gauze. If a caregiver is taking down your pump, they will need to put on the mask, the gown, and the two pairs of gloves. If you, the patient, will be taking your own pump down, you will only need to put on two pairs of gloves. Remove all items from your kit. At this time, apply both pairs of gloves to your hands. Now, you are going to turn off the infusion pump. Stop the pump by clamping the pump tubing. Remove any tape that is covering the tubing connector site. If your gloves become sticky from the tape, remove the outer pair of gloves. Place the used gloves in the yellow waste disposal container. Now you will disconnect the infusion pump. Disconnect the tubing from the port by gently unscrewing the tubing from the port. Place pump and IV tubing into the yellow waste disposal container. Pick up an alcohol pad and clean the end of the port cap by wrapping the alcohol pad around it and scrubbing for 15 seconds. Let it air dry. You will flush your port before removing the needle. Remove the cap from the pre-filled sodium chloride syringe. Be sure to remove any air from your syringe by gently pushing the plunger until you see the solution at the tip of the syringe. Connect this syringe to the end of the port by gently screwing it into the cap at the end of the line. Push 2 milliliters of the 10 milliliters of sodium chloride into the port. Pull back on the syringe plunger to check for blood return. Then push the rest of the sodium chloride into the port. There is an extra syringe in the event you drop a syringe on the floor and it can't be used. You may use a second sodium chloride flush to rinse the line again if needed. Scrub the end of the port cap with alcohol for at least 15 seconds and let it air dry. Remove the cap from the pre-filled heparin syringe. Again, be sure to remove any air from your syringe. Connect the syringe to the port cap. Push only 3 milliliters of the 5 milliliters of heparin into the port. Make sure to let your provider know if you did not see a blood return from the port or if it was hard to push the sodium chloride or heparin into the port. You are now going to remove the dressing from the port. Slowly remove the port dressing by lifting up one corner and using an alcohol pad to loosen the adhesive. Continue to do this until the dressing is ready to remove. Remove the port dressing and put it in the yellow waste disposal container. To remove your port needle, take your non-dominant hand and stabilize the port device. Using your dominant hand, grasp the needle and pull it straight up and out until the needle engages the safety lock. Place the needle in the yellow waste disposal container. Apply the sterile gauze pad to the port site and cover with the Tegaderm dressing. You can remove the dressing in 24 hours. You have successfully taken down your infusion pump. Place the drape, your outer gloves, and any remaining items in the yellow waste disposal. If you are a caregiver, your gown and outer gloves may be disposed of in the regular trash if there was no chemotherapy that has spilled on them. Wash your hands with antibacterial soap and water for 30 seconds. Then dry your hands with a clean paper towel. Place the paper towel in the yellow waste disposal. When the container is full, bring it back to your next clinic visit for proper disposal. Until then, keep it out of the reach of children and pets.